HMPV is nothing but human metapneumovirus. It is a respiratory virus which affects human beings. Not at all. This virus was first discovered in the year 2001. It is a part of family of a respiratory syncytial virus, which this virus coexists with that, and it affects people or population especially during winters, late winters, and it is more prevalent in colder countries compared to warmer countries. People who are at risk for HMPV are those population whose immunity is not properly developed or immunity is compromised. So children below 5 to 7 years, there is still a developing immunity. They have not developed resistance to most of the viruses. So cross resistance would not be there. These children are more prone for this infection. Not only that, children who are having pre-existing airway problems like severe asthma or any other severe infections like tuberculosis or malignancies or cancers, children who have got renal problems or heart problems, or children who are on long-term steroid therapies or immunocompromised therapies. So these are the children who are more prone for severe infections and who are at risk. Not only that, even adults who are in house, who are above 60-65 years, who have got pre-existing heart problems or lung problems, who are on a long-term inhaler therapies, even this population who are immunocompromised again are the ones who are at risk for this. Normally this will not affect healthy population. So symptoms of HMPV is similar to any other respiratory viral infections. Just like your flu and your RSV infections, you have similar symptoms like it starts off with running nose, cold, followed by sometimes breathlessness. Sometimes the children might wheeze, means they might have whistling sounds, followed by sometimes they might have severe cough, which is more prevalent during night than during day. Then it can be followed by fever and body pains, which can be there for longer duration of times. So these are the common symptoms, and because of these things, the children might not feed well, children might become dehydrated because of this, and these symptoms usually last between 2 to 5 days and settles down by day 6 to day 7. See, when should we worry as far as HMPV is concerned? Because children normally get cold and cough. That's very common in children, and this is a time, winter is the time when, because of the conditions, children usually get more colds, coughs and fevers. So when should we worry? It is very difficult for us to identify one virus from another, and it is very tedious to test for this virus for every cold and cough. So when we should worry is if any child's fever persists beyond 4 to 5 days, the child is not taking any feed at all, or is having severe breathing problems, or child's color is turning blue, or the child is vomiting continuously, or the child's saturation is dipping and child is not conscious, or not in a position to play around when the fever settles down, not active at all, or not passing urine regularly. Any of these signs are there associated with your regular viral infection, which is very unusual, then this is the children who are at risk, and we are supposed to approach the hospital and see that the child gets adequate treatment. Any vaccinations available as far as HMPV is concerned? No, there is no vaccine for HMPV, absolutely. But does any other vaccine provide a cross protection for HMPV? Still no. But I would recommend the regular vaccines which are available for respiratory conditions. Ensure that your children are vaccinated, because these conditions actually, these infections are coexistent, might confuse us further with this virus. How to prevent HMPV? Basically, HMPV is spread by 4 mechanisms. One is respiratory droplets, another one is by direct contact, other one is by surface contamination, and the last one was by airborne spread. So what is a respiratory droplet says? If any secretions are present in and around the child, somebody is having cold and cough, the child comes in contact with those secretions, then the child is bound to get it. Second one is surface contamination. If any surface is loaded with these respiratory particles, the child is coming in contact with this, the child is bound to get it. Third one is direct contact. Any person is having cold and cough and directly is in contact with the child is going to get it. The last one is the airborne, especially if you are going to any crowded situations like railway stations, bus stations, or functions, or situations like that where there is a crowded population, including schools, where the respiratory droplets will be in the air for the longer period of time, and this is how the child usually gets contaminated. So this is how the child usually gets. Only the way to prevent it is by wearing mask, hand sanitizing technique, maintaining a social distance, avoid gatherings. And if any person in the family has got cold and cough, better they wear the mask for the entire duration. They need not restrict themselves from work. Better they wear mask for the entire duration and don't come in contact with the child as much as possible. So what is happening in China right now? That we should be worrying about. What is the latest news? Because social media is bombarding us with too much of information too fast, and it's creating a panic situation among people. First and foremost, let us come to the facts. What is the factual information? What is happening in China right now? So what is happening in China right now is there is an outbreak of viral infections, which is very common in China or any other country, especially during this period. The problem right now, what is happening is because there will be always coexistent infections which actually creates a maximum problem. In China, it's not only the HMPV which is creating a problem, there are coexistent infections which are associated with HMPV, like mycoplasma pneumonia, which is very common. It's existent in India also right now, and respiratory syncytial virus, flu-like illness, all are clubbing together and coming together. They bombard especially during these 1 to 2 months. So when huge population is affected by these multiple organisms at same point of time, there is an overload on hospitals. You suddenly see that the hospitals are surged with patients and surged with OP patients, and there's a huge overload because all the population, majority of the population spectrum are affected at same point of time. And the spread of this virus are very fast and rapid. It affects one person, the whole family gets affected within no time. That's the reason why there is a rate of infection happens, and the people who have to handle it are quite few. Not only that, the other problem is after COVID, the diagnostic methods and technologies have improved drastically across the globe. Initially, before just a few decades back or a few years back, diagnosing individual virus was a very tedious process. Right now, these viruses can be diagnosed within few hours. That's the reason why even though these viruses were pre-existing since many years, because we are in a position to identify individual viruses, suddenly they have come to limelight. They might have been there since generations or since years, but because we are identifying it very rapidly, the name of that virus is becoming more prevalent. So this virus is there since beginning just because of the coexisting infections, just because the diagnostic methods have improved. That's the reason why this panic situation has arisen. But whatever information we have got so far from the WHO, from the Indian government, or whatever it is, they said that this virus is not as dangerous as COVID. And only thing is that the general preventive measures, whatever we follow for regular respiratory viral infections is followed, it should be safe enough. I don't think we should be worried about really, and we should rush to the hospitals where we are prone to more infections. Especially take general precautions, manage it as a regular viral infections, know when to approach the doctor and see when to be managed. I think this should be enough as far as management of our children is concerned and management of our future is concerned. Thank you.